What if women could vote on the future of their own healthcare, not just through policy, but by contributing their data, owning their stake, and actually steering research decisions? That's what today's guest is building. For today's episode of Token for Your Thoughts, we're joined by Veronica Kirin, a serial entrepreneur, anthropologist, author, and founder of Asterisk Women's Health, a project working to rewrite the playbook on women's health by building the first ever female-specific data lake, using Web3 tools to put power back in the hands of patients. Veronica, welcome to the show.
Hi. Love that intro. It's great.
Oh, good. It's great to have you here. We have a lot of really interesting things to talk about. I'm excited to hear what you're doing with Asterisk. But first, it would be great to start by hearing a bit more about you and your journey of how you got here. You've launched non-profits, tech companies. You've written an award-winning book. You've been very busy. So let's hear about all these amazing things you've been doing prior to this and how you got here for this next venture.
Yeah. So I actually am an anthropologist, and I love to throw that down because, first of all, there's a lot of people who go to university and then they get pushed into that question of like, well, how are you going to make money of this? It's just like, do it. Just do what you want to do. Learn what you're going to learn because they're drawn to it for a reason and you will figure out how to use it. So I am an anthropologist and I study paradigm shifts. That's what my book is about, actually about the high-tech revolution. And I use that every day. I use anthropology to support my team, to translate Web 2 to Web 3, and to hopefully implement a paradigm shift here in women's health. Because we need it. But, before that, in between the studying of the anthropology and the women's health org, I had an NGO for a little while. That was my first venture, which is like venture on hard mode. I don't recommend making that your first foray into entrepreneurship.
Okay.
And then I had a Web 2 tech company, which I exited in 2018, a few other startups in between, and then spent basically from 2018 to 2023, like not really retired, but like consulting retired. I just I didn't know what else I wanted to do. And I had a lot of knowledge from my exit for how to scale. And I was really adamant about protecting people from burnout because part of the reason that I exited my company was because I was burnt out. And so like already in the health mindset of like, how do I make sure that I'm translating entrepreneurship in a way that is supportive to other people, and how do I make sure that I stay in a healthy space? I moved to Berlin during that time, and so I have experienced 2 different health systems. I have 3 female-specific disorders, which is really like winning the lottery. And it means that my healthcare is kind of not the greatest. And I noticed that. So it's easy to be in the United States and be like, well, it's American healthcare. So, you can just kind of like discount it. But being in Germany, I have way more access to healthcare, like an insane amount. I actually have to say no to doctors' access to healthcare. And yet I have the same problems. And so it revealed to me, this isn't a problem of this system. This is a global problem. And then, of course, digging deeper and deeper, discovering that there's just this complete trough where women's health data should be. And not just that the data is missing, but also what little data we have is very much biased towards reproductive health, which, yes, those are female body parts, but that's not the whole woman. So that's how I fell into starting another venture and launching Asterisk and trying to change the world.
I love it. Why not? Have you always had an entrepreneurial streak, would you say, growing up? I mean, how did you decide to go and start an NGO? Were you in like a day job before, or did you just go straight into it out of
No, well, so when I was 10, I had a sewing machine and I sewed Beanie Baby beds. So
oh my
just
gosh.
to like date myself so hard. And I went door to door selling Beanie Baby beds for $5 a piece.
Amazing. Love it.
So I had like something in me. But
Yes.
no, so out of uni, I joined what's not very well known, the National Civilian Community Corps. So it's kind of like the civilian National Guard. It's disaster relief work where you deploy in the United States for natural disasters. So
Oh,
anyone who was on the ground after Katrina saw us. They saw the gray and green shirts with the emblem on the side. We were there and we were responsible for, I think, about 70% of the cleanup,
oh,
because
wow.
it was just young people being thrown into harm's way, and they were like, "Just go do, you'll be fine."
Oh,
I
gosh.
don't know. Yeah, it wasn't like, but so I really, that was like my first experience with burnout, because I was on the ground for Katrina. I did fire
Hmm.
reconnaissance in California, and then I also was one of the first responders, like literally one of the earliest groups to be on the ground for the tsunami after American Samoa.
Wow.
And so I saw a lot, and I was like, okay, I want to continue doing this type of work, but I can't do it in this way anymore because it's really it's bordering on trauma. Like I can't do it. So that's where
Yeah.
the NGO came from. This like
Okay.
idea that I want to continue to do good. I want to continue to put my energy towards this direction, but I need it to be different. And
Hmm.
I don't trust this organization. Well, I was working for the government, so yeah. Anyway, it didn't. So the NGO worked for 2 years, and then it didn't.
Hmm.
And at that point, that's when I started my Web2 venture, and kind of just like took like a detour of just trying to figure things out in life,
Hmm.
and now I'm back into more impact-driven work, which feels a lot better again.
Right. Yeah, I bet. Wow, that's an incredible story. And then I was also going to ask about your background in anthropology because I find this so interesting. I saw you speak at the Eve Wealth conference and you had a really interesting story about paradigm shifts and your experience during COVID. Can you tell us or share a little bit more about that? Because I just found it so fascinating. It sounds like such an interesting thing to study and then to just to have that outlook in everyday life. And like you said, to witness a huge paradigm shift during COVID must have really been
Yeah.
something because they don't actually happen on that scale that often, you were saying.
No. Yeah, exactly. Like to have it wasn't just like scale, because we have had global paradigm shifts that happens all the time. You could say the high tech revolution was one of them, but to
Hmm.
have it happen in such an acute, like within a year, everything was different. Period. End of
Hmm.
story. And so yeah, I joked, as you heard me say, like maybe it was my own coping mechanism to study it while it happens, but
Uh-huh.
like externalizing the trauma. Um, but yeah, I just knew I had to document it ethnographically, because I knew that this was a once in a millennial situation.
Hmm.
And it helped to galvanize my understanding of how paradigm shifts work. Because again, a lot of times we're looking at paradigm shifts that happen slowly over time. So they can be very like intangible. Like you'll have a revelation technologically, but like it still takes time to roll out. So
Hmm.
um one of the examples I like to use is Google Glass. Like we had that technology, but then the culture was like, like you just I don't know. So that's
Yeah.
why I said like we need crisis and we need opportunity in order for a paradigm shift to happen. It's like osmosis. Like you have to have the two pieces in order to move the energy.
Hmm.
And for Google Glass, like the opportunity was there, the tech was there, that's cool, but
Yeah.
the crisis, which is a scientific term for just that energetic need in culture,
Hmm.
wasn't there. We were not interested in it. Whereas in the pandemic, yeah, we had a crisis, literally and scientifically,
Yeah.
in culture. Culture was excited. If you imagine atoms be excited, and the technology then was developed out of that. So the example I use was the vaccines. That bam, we were all ready for it, even though it was radically new technology. It was ready within a year, and here we are.
Hmm.
Um, so yeah, to think about that from the standpoint of somebody implementing a paradigm shift, um, I think so within our culture, like between you and me and every other woman, like it feels pretty clear. Like yeah, of course. Like I want my healthcare to be better, and it is weird that sometimes I go to the doctor and they're just like, you don't know, and then you start to look at the statistics and you're like, this isn't right. But
Hmm.
power holders have to still also feel the crisis. And unfortunately, a lot of men aren't quite there yet. So that's why I was saying, like I'm trying to excite culture by founding a magazine to inspire empathy through storytelling. And then the opportunity is Asterisk. So I'm creating the technology so that the shift can happen and be seamless, and nobody's the wiser.
Yes, get all the pieces together because yeah, that makes sense, and I think there have been other examples of that, right, where there's been technology, but then people just haven't been ready for it, or there hasn't been a huge need or a huge crisis. So, and that's as well something that's you can't, I mean, like you said, you're starting a magazine and storytelling, you can raise awareness, but I guess that's the harder part to engineer, right?
Yeah.
Okay, so that's really interesting. So you have experienced US healthcare, you moved to Berlin, so you had experiences with two different systems. And I think that's really interesting that really helped, you understand what the issues are, because I have experienced this as well. I grew up in London, so I've experienced UK healthcare and US healthcare. But a lot of the conversations I find are around access. Like you said, that's always a big one. How long does it take to get seen in the emergency department or to get a primary care doctor, not hair. And then funding and the money side of it, which obviously is huge, insurance versus universal. But something that I don't think I've ever heard, or very rarely heard, is actually, like you were saying, is the data or the research that supports the treatments, etc. I feel like it's the conversation I've heard a lot is about the other two things. So that's really interesting. And having looked into some of the research that you have shared, the stats on this are pretty shocking and pretty mind-blowing. Most people have no idea how big the gap is in non-reproductive health data. What are some of the wow stats that you can share with us? Because I was reading through a few and it was kind of shocking.
Yeah.
Yeah.
I mean,
What are some of the ones that stand out?
I think the one that is my favorite is like, okay, like we're in 2025, and yet, like, so when you're studying female conditions, so they're female specific conditions, and you're bringing them through animal trials, and it's for female conditions, like only female. Well, like, wouldn't it make sense to have female animals? No. Still in 2025, only 12% of female specific animal trials are using female animals. And I'm like, what? That's like, it's animals. It's not even like, okay, we had like a hard time on recruitment. It's animals. And like,
wow. For female specific drugs. Is there a reason? Has anyone explained this?
So the reasoning, and okay, so, like I have all of my feistiness behind this. So a proper clinician will explain it probably a little bit more level-headed than I will. But
okay.
The female body is on a cycle, 28 to 32 day cycle, right? What we know is that during different parts of your cycle, different chemicals, drugs, work better than others. We know in sports that like women are more susceptible to twisting their ankles during various times of their cycle. So you have to work out differently, right? Same with ADHD medication, for example. So we know that ADHD medication does not work as well when a woman is in her luteal phase. So can you imagine being a pharma developer and trying to bring a drug to market that doesn't work that great half the time? You would never.
Okay.
So yeah. But I still, again, I'm feisty. So I'm like, okay, we send man to the moon. We can totally like manage the complications of women's bodies. And I posted this to our Blue Sky earlier this week. I was just like, what if in research we instead of approaching women's bodies as too complicated, we decided that men's bodies were too boring.
Oh my God, I love it.
Like, just what if?
Perspective change.
Like, right, because it's not actually, yeah, and that's the paradigm shifting coming in again. I love twisty things. But and the reason I push on that is because there are studies going through right now that you can look up on clinical trial databases that say that they excluding women because their bodies are too complicated. And I'm just like,
What?
what year is it?
That's crazy. For especially if it's for a drug specifically for women, that is so bizarre. So they basically just want to use the male animals so they can just say, yep, it works great, and not have to say like, oh, well, it does, but during this phase there's issues. And
I mean, it's like it's a whole nother layer of tracking,
yeah,
right? Like, so like
yeah,
are
it's
women
just more
on
work, more expensive.
it's absolutely more
Yeah,
expensive because so like I either need all of the women to be on birth control, which is an entirely different like can you imagine living in a world where we understand how other drugs affect the female body when on birth control versus not on birth control?
yeah,
Versus like we have no insight into that. So you either need all the women to be on contraception, so like all of their cycles are flatlined and thus the same, and then
hmm,
like that's a control, but then at the same time you're missing out on really how does the drug or modality or whatever you're researching affect the female body. And so then
hmm,
you would at least need women to be reliably tracking, which we have the technology to do,
yep.
you
Hmm.
know, but that's why.
Okay, that is a really interesting and yes, kind of shocking stat. Thanks for sharing. So a lot of room for improvement there. You have said that funding women's health doesn't automatically put it on the road; it just puts it on the map. Can you expand on that for us?
Yeah, yeah. So I mean, like my shock value statistic is like, we've had Western health for about 500 years, and for 450 years, women were left out of the equation because it wasn't acceptable for women to be involved, or they were banned, like they were in the 1900s. And by the 1900s, I mean the 70s through the 90s, not like, this is
Yeah,
recent. This is in my lifetime.
yeah.
Again, wow, aging myself. So, it's like, do you remember the 1900s?
Oh
Oh
my
my God.
gosh, I know. Don't. My head always goes to like 1912 as well. Like when you
I
say that,
know.
not
Like,
like the 80s, 90s.
yikes. Yep. So we all know like women like Mary Curie had to fight to get her Nobel Prize, right? So like even like the cream of the crop top women researchers were not involved. And then of course just going straight down the line, like women as far as like participating in trials, it just like it was much more rare. So women have been
Hmm.
left out, left out, left out, left out. And so I say 500 years. It's probably not quite that extreme, but that's what I say. And then yeah, so like that's just where the gap is coming from. Is just having been left out so much. And now we have to
Hmm.
figure out like my favorite example is what I call the Ambien fiasco, where we had this medication come out in the 90s. It was tested on only men's bodies. And so the dosage was incorrect for the female body. So much so that women were going psychotic on it. There
Oh
are
gosh.
TV shows like Law and Order episodes that show like I was like sleepwalking. I did some crazy shit in my sleep, or I drove the car. Like this
Oh
was
my gosh.
real. And finally, 30 years later, it took 30 years for the FDA to say, it's half the dose for the female body,
30
which is
years.
not a little amount. That's like a lot. And so these are the consequences
Hmm.
that the drugs are not indicated for the female body. The symptomology isn't indicated for the female body. Do you know what a woman's heart attack looks like?
I've read that it's very different, and now I'm like, yeah, it's escaping me. But you're right. I've
But
I've
you know
read
what a
about
men's
this.
what's a men's heart attack look like?
I'm picturing someone like grabbing their heart,
Right,
like
like,
freezing
oh, the
up, and
pain,
yeah, yeah, yes.
sweating, my arm hurts. Oh, right. Yeah, a woman's gonna feel fatigue, nausea, back pain, maybe a headache. You go to the ER
Wow,
saying that as a woman, they're gonna be like, okay, like go take some Tylenol and go home and go to
wow.
bed. And that's why we're twice as likely to die for a heart
Oh
attack.
my
So it's
gosh.
just like it's just systemic, and at this
Hmm.
point it's a whole lot. So that's why we're going for data, just to try to like just get something
Hmm.
in the car as it starts to go down the road.
Absolutely. And you do hear so many instances of women getting diagnosed a lot later, their symptoms being dismissed as something like you said, oh, you've just got a headache, go take some Tylenol. And then it turns out to be something really serious. And that is
Yeah.
crazy. 30 years and half the dose. Oh my gosh, that's a long time. Yeah, and it's just not, it's just crazy too, because like everyone knows that men and women's bodies are very different. You know, it's like what comes to mind, obviously, like the alcohol effects, you know, like on they're different, right? For men and women, like the driving limits and so many things are like, if you're a man, it's this, if you're a woman, it's this. So it's not like that's new information. So yeah, it's bizarre that this thought wasn't automatic.
Yeah. And it's not to be like doom and gloom. It's just that like you can't advocate for yourself if you don't know. Like
Yeah.
I just made a TikTok that'll go out next week for so we're on TikTok at Asterisk. We went
Love
viral
it.
last year because we made some men angry. Just throwing down facts. But like you can't advocate for yourself. So like I said in the video, like if you go to the doctor and they offer you a medication, ask them, is this the female dose? Because there might not be a difference, but there might be. And a lot of doctors just don't know because it's like so systemic that like doctors don't realize to look for it because they only get 3 to 5 credit hours in like women's health in the first place on average. So I know. I'm sorry. I'm not trying to. I'm just saying like no to advocate for yourself, like at the very least, while we in the background, we're going to do the work.
That's really good advice. I have never thought to ask that, but that's good to know. That's a good question. So you have experienced these two different healthcare systems. It spotlighted the problem with data. What led you to start Asterisk?
Yeah, well, so one of my conditions is premenstrual dysphoric disorder, which again is not related to whether or not I can fall pregnant. It's just that one of the receptors in my brain is broken and way oversensitive to the hormonal changes that I have every single month. And so I have, a lot of deep depression experiences. And it gets worse as you approach menopause, which is so exciting. Great news. And so I was having, it was something I had coped with before, and all of a sudden it was getting worse and worse and worse. And I was like hitting crisis too many times. And so I was actively seeking for support and just digging for it. And that started to really open the doors. I'm really thankful that I have a fantastic support network here in Berlin. Like I have found a great medical team. And again, the access has been there who will hold space for the fact that we just don't know these things. Or if I bring a stack of studies and I say, we need to consider this as part of my treatment plan, they'll say, okay, I don't know anything about this, but I see you have studies and I will pay attention and go through it. So like that has been my saving grace, but also my driving force that like I am looking down the barrel of a lifetime dealing with a few conditions that will just never be solved. Not for me. And that's sucky.
Yeah.
And I can either be very, very angry about it and further injure myself, or I can start something that might help the world. And so I chose the second door.
Amazing. I love that. You're taking this issue and turning it into a positive to build something. And not an easy problem as well, hearing these stats. That's incredible. And how do you explain Asterisk about what you're doing?
Yeah. It's like it takes even just so much to explain the problem. So the solution is actually fairly simple. Like we need to get data to researchers ASAP. Period. End of sentence. And make it cheaper, faster, just like all of the things, like better, easier, cheaper, faster. For women, we need to be involved. For too long, we haven't been, right? And so there's a lot of assumptions that have been made. And 90% of research happens in the global north. So what little women's health we do have is white women's health. So again, like these are not paradigms I'm willing to reinforce. So we've created a daily check-in app. It feels like a menstrual app, except for we're not asking you about your period symptomology. We're asking you about whatever disorders and medications that you have indicated you are in care of at this time. So you have a profile, it's basically static. And then every day we ask about that, and you get to share as much or as little as you want to, but that data then goes into the data lake. So it's longitudinal data. Every single day we have more and more data from women around the world in their own words explaining what it's really like to be a woman with these disorders, taking these medications, if we do fall pregnant, if we are caretaking. So we're looking at stress levels as well. One of our clinicians indicated that we really need to be paying attention to stress as well as just general symptoms, because often they go hand in hand. All that goes into the data lake. And then that can be accessed in real time every day by clinicians and researchers around the world, and sorted by age, ethnicity, location, and then disorder. Are you pregnant? Have you ever been pregnant? What medications are you on? Are you self-diagnosed or professionally diagnosed? And on and on and on. So as you can, like, I could see your eyes lighting up. Like it's super powerful. And our participants who, yes, become part of the DAO because we are tokenizing their responses, but they also, in their app, they can indicate if they are open to further participation in trials and focus groups. So now clinicians can find women faster, easier, again, right? Like, we're just trying to lower barriers on all levels. So, like, women get to participate, they get to vote because we're a DAO. Clinicians immediately get access to real women, not data parsed through like all these different layers of assumptions. And then hopefully we've just, saved the world and I can go to bed.
Amazing. Good. All in a day's work. That's incredible. Wow. So solving that issue of collecting data, like you said, from women around the world, not just, in the North.
Not just the global North, not just white women. No.
And then providing access to women for trials as well.
Yeah.
So numerous solutions there. And you mentioned about voting. So what kind of things do we vote on?
Yeah. So initially we are looking at like what specific types of studies, initiatives, partnerships happen within the DAO. We have a couple different phases of world domination that we are going for.
Love it.
So we're starting with the data gap, but then we are going to be looking then at the IP gap and eventually the funding gap. So like we'll eventually get there. And so my hope is that in 5 years' time, we have over 1 million users around the world, and they can vote on like where are our initiatives and our efforts going, because we want to actually become a really active organization within the women's health space. So like, yes, we're starting small, which I put in quotes because like this is not small, but we're starting specifically with data, and then we have plans to expand, because I don't see this as like, I'm not just here to like start a startup and then make some money and then exit. Like I'm here to actually like solve some problems, and it's going to take a long time. And I think that women deserve a say at all these different levels of health. So not just like what the research shows, but then also how data is used and what initiatives are happening on the backside. Like the veil has not been pulled back to us, like, ever.
That's really powerful. I think that's a really incredible part of this is not only contributing to creating data and opportunities, but having ownership as well, and a say and a seat at the table is, as we know, not something that's always available. So love that is baked into this. And you mentioned tokenization. Can you explain to us a bit more how that works?
Yeah, so we're a bit early on this. So right now, we are rolling out our MVP this month. We're actually just like we're literally crossing the T's and dotting the I's, buttoning everything up right now.
Exciting.
So an announcement is coming soon. Probably like by the time this episode comes out, there will be something like public out, and we'll
Amazing.
be going to alpha testing. So what our alpha and beta testing look like is more like a point system.
Hmm.
And so as you engage with the check-in every day, you'll receive a point. That then we are working with a tokenomics in order to create a proper conversion into tokens. So like the earlier you're involved, obviously then the like more it benefits you. So that's our like call to action to anyone to like get on the wait list now, because if you join us at this early stage and you trust us at this early stage, right? Like we're brand new. So like it does take a bigger leap of faith to engage with us. And I
Hmm.
really recognize and honor that. And then the result is, okay, like the payoff for your risk of joining somebody that you don't know where it's going to go next, is that you will have a greater investment in the organization, greater voting power in the organization, I believe.
Awesome. All right, that's exciting. We'll have to make sure to get on that wait list and get involved. So you're focused specifically on non-reproductive health, non-fertility, which is rare in this space. This was another one of the stats that I was wowed by, about how the majority of funding, right, goes to studies or projects, femtech, that are in the reproductive space. Is that right?
Yeah. Yeah, they really do. About 80% of the funding is going towards reproductive health.
Hmm.
And that just comes from that old paradigm of thinking that women are just small men, except for wear bikini covers. I like really when I discovered that term, bikini medicine, I was like, what the? Like, I was like at my keyboard, I'm like, I have to write an op-ed about this. This is absolutely ridiculous. And then just
Wait,
finding
that's a
out, like,
term.
that's the term. I know. It's like,
No.
it's awful. Yeah. And it also like, okay, it's like, well, it's like bikini medicine, it's like wear bikini covers, but it also indicates this like lack of respect, like oh,
Yeah.
it's bikini medicine is like women's health. It's
Hmm.
like I'm like women just want to sit on the beach and drink mai tais, and like that's the health level they need. Like it somehow communicates that
Yeah.
in
Hmm.
addition to it's just where the sun don't shine. So
Hmm.
so yeah, so it's part of this old paradigm. That's why so much funding goes towards reproductive health for women. It's why when you see women's health centers, they're OB-GYNs, they're sex therapists, they're fertility clinics. Like that's what we see over and over.
Hmm.
Um, and so that's why we have non-reproductive health like on like the very front of our homepage, on all of our documents, our pitch deck, our one sheet, our vision paper, because it's really important to draw attention to this old paradigm
Yeah.
and say like we're here to completely go to the other side of it. There are reproductive health databases. There aren't non-reproductive health databases. Nobody's in this space.
That is also something else that completely blows my mind, because there's a lot else going on outside of
Yeah.
reproductive health. We have a lot of other body parts, a lot of other organs, all of it.
Surprise.
That's really shocking. 80%. Wow. So I think that really does just spotlight how important this initiative is, and just how much catching up we have to do in order to get to other areas of healthcare that we need. So what's it been like building this mission driven? Like you said, it's not just about making money, exiting. It's really solving this huge problem that could be super impactful for women all around the world. What has it been like building a project like that in the Web3 space? Has there anything that's been surprisingly easy or unexpectedly hard?
Hmm. So from like a general standpoint, it's been really inspirational. And I say that because I have a team of 10. 9 of them are women. So I think we're like one of the most female teams in Web3. Half of
Gosh,
our
yeah, I bet.
team wasn't even Web3 native. I had to teach my co-founder what Web3 meant and how it all worked.
Hmm.
Um, so that I think, yeah, as you said, it speaks to the mission, and like nobody's paid. I lied. Our developer is the only one that's being paid. but yeah, like, so I have these incredible women from all areas of expertise and walks of life who are all
Hmm.
saying yes, even though we don't even have funding yet. Like, we're on the cusp. We're finally, the seesaw is finally balanced, and we're like, it's gonna
Yes.
tip, it's gonna tip, it's gonna tip. Like, we're
Yeah.
right
Come
there.
on.
But I mean, we've been doing this for a year and a half, and they've been along for the ride. And some duck
That's
in, some
amazing.
duck out. Like, we all
Hmm.
have a whole lot of other things going on. And I worked really hard to keep that part of the ethos of the organization, that, like,
Hmm.
even though we're in Web3, we're not going to hustle hard. We're going to do what makes sense and what's right. And so I've even had to step away for like a couple weeks to just say, like, look, like, you know, my cousin passed away. I need to be gone, and I need to go take care of my family. And then,
Yeah.
you know, like, they say, okay, we've got this. And like, people come in and they fill the gap. And I've loved that. I loved the DAO ethos that
Hmm.
brings that. Um, I'm I'm not the most excited about always being on a panel called Women in Web3.
Oh, yeah.
We joked about that at Eve Wealth.
Yes, we did.
I
We were like,
loved that.
when's the men in Web3 panel?
Yes, and I've
I
actually
love that.
said that to a few organizers. I'm
Hmm.
about to hit Eve Wealth was like the first in the full, like, conference circuit, so I'm about to be, over the next month and a half, I'll be in 5 countries.
Wow.
So, so is the life of the founder. So prepare
Yes.
yourself if you're thinking about it. Um,
Hmm.
and I've said it to a few of the organizers who are inevitably male, and they're like, "Oh, I really see your point. Yeah, let's do something different." And I was like, "Yes, yes, yes." So,
Nice. Well done.
and there's also been the inevitable, like, dude bro comments,
Hmm.
and or even an investor has said, like, I've heard of femtech, but what about mentech? And I was like, that's the past 500 years. You already have mentech, like, kind of like. So there's been, like,
Hmm.
inevitably, when you're swimming in such a space, Web3 is only 27% female. Okay,
Hmm.
and then Web3 founders are only 12% female.
Hmm.
And so when you're in this space, inevitably there's just gonna be somebody's gonna say something.
Yeah.
Um, so I
Hmm.
guess, like, I'm just feisty enough to be like, yep, no surprise, moving on. I'm gonna write that down. I'm gonna make a really funny TikTok about this later. Like,
Yes.
like, just kind
Yeah.
of, if I internalize absolutely everything that happens anymore, like, I won't go anywhere. So
Yeah, I think that's a good approach. One of the things that we were laughing about at eWealth, someone said that there was actually an instance at one of these conferences where they did have, they had a women in Web3 panel, but there were all men were on the panel. They had no women on the
oh
panel somehow.
God.
And they were like, what is going on here? Like, just
But
what?
I've seen like women in Web3 panels where then, like, the moderator is a man. And it's like
Okay.
the same thing as, like, what? And I'm actually going to be on. I was laughing so hard when they were talking about that, because I'm going to be on a women in Web3 panel
Oh.
next month at one of the conferences. Yeah.
Well, showing up, yeah, getting out there. You got to do what you got to do.
Yeah.
But that's nice that the organizer you did speak to was receptive about doing
Yes.
something new.
Yes.
Um, all right, and you mentioned talking about global travel, traveling the world. You're scaling globally,
Yes.
planning local DAO chapters. What's the vision for how this community grows? I love that you are thinking very inclusive in order to get data and involvement from women worldwide.
Yeah. I think, like, my time running an NGO, and being an anthropologist, and, like, having those two worlds cross, being in disaster relief. I mean, I was deployed to American Samoa, which is a very different culture than what I grew up in. And we had to do culture training. We had to learn, like, you do not point your feet at somebody because it's rude. You always sit lower than your elder because that shows respect. And you always sit
Wow.
down when you eat because that shows respect to the food, that something died for you, whether or not it was a plant or an animal. And you had to internalize these.
Hmm.
And so, like, being an anthropologist and a disaster relief worker and an NGO worker, like really buried into me very deeply that there is a problem in the NGO space of white saviors. And
Hmm.
I can only speak to my own culture and my own experience. I should not ever be speaking for people who have different experiences than myself. I can only center them and give them a platform. And so that's why we have an ambassadorship program. That's why we want to have chapters, because
Hmm.
I am certain there are things that I am not thinking of in the development of this app in this
Hmm.
first wave. We're going to discover, and we're going to discover it because we have people around the world who will test it and tell me, hey, you
Hmm.
silly European woman, you forgot blank. You didn't think
Yeah.
about this. People aren't going to use
Hmm.
it this way because of, X, Y, or Z. Um,
Hmm.
that's critical. Like if 90% of health research is in the global north, that means we're talking about it from a very specific angle, which means I've learned to talk about health in a very specific way. And
Yeah.
so I expect there to be blind spots, and I hope to find them as fast as possible.
Hmm. Absolutely. It's a really good point. And I feel like there have been so many interesting anecdotes of examples like that, where something gets built and then, the sort of non-typical person comes across it and then gives feedback. And otherwise it would have been completely overlooked. And I think that's a really great perspective to have, is like, there will be blind spots. We don't know what they are, but we'll find them.
Even even the term blind spot, like look at the words, the verbiage we're using, because
Hmm.
like my ideal is that we do have people who are hard of sight or even blind using the app eventually. And so like, how do we build for disability so that we are
Hmm.
truly inclusive? Because that's a huge part of the female demographic, right? We
Yeah,
have to have that involvement. And like, yeah, even the
absolutely.
terminology we're using,
Yeah.
right? Like, so yeah, this is why like I'm trying to pull in as much diversity as possible, as many voices as possible from the get-go. Um, if you're listening to this and you think like you have a unique perspective, please approach.
Amazing. Yes. And on that note, if someone listening wants to get involved, whether it's a researcher, community member, where should they start? Where should they go?
The easiest place is our website,
Hmm.
asteriskdow.xyz. Um, so if you are just interested in starting to test the app, be one of the first participants, get in on that point system, it's right on the homepage. It's like so obvious. It's a big pink square. And then
Nice.
in the menu, if you want to go deeper, in the menu, our one page is there. And that's where I would recommend you go next. Look at what what our chapter needs are, what our current initiatives are, and then use our contact form to reach out. It will go right into my inbox, and I will then begin communicating with you, and we'll see what we can do. We currently meet weekly, so we're just always sprinting. And working towards the next thing. And yeah, hopefully, not hopefully, I mean, the MVP is coming out this month. I don't understand it yet because it's been so long coming. My brain's like, what?
Yes, it's
It's
actually
real.
happening. What's going on?
Yeah.
That's so exciting. Is there anything else that we should cover, or that you want to talk about, or did we
Mm,
did we get to it all? I mean,
I
not
feel like
all,
we've
obviously, but
done, oh, yeah, I know, like we could go
there's a
for a
lot.
long time.
There could be
But
part two, but
I'm always down for a part two. Like, you could do like a 6 month, like, what if we discovered where was Veronica
yeah.
so wrong? Like, let's go for it. But yeah, I mean, that's what I'm really interested in. Like, I want more voices involved. We have this core team of 10. They're incredible, but we do have to expand. And it's just never too late to bring on somebody new. So I just, with a great amount of humility and deep amounts of passion, invite anyone listening who feels excited about this, like come in on any level. But even if you feel like, well, I don't have time, join the wait list. Just join the wait
Join the
list
wait
because you'll
list.
be able to give feedback that way, and that will be our treasure from you.
Amazing. Well, this has been such an incredible conversation, Veronica. It's taking on such a huge problem here. You've got this incredible solution that has the potential to impact women everywhere, worldwide, and just be truly revolutionary for women's health. So bravo for taking this on. It doesn't sound like it's an easy road, but this sounds like a fantastic way to tackle this issue, and can't wait to see everything that happens for you and Asterisk. So we will be leaving the links to your website, your socials, all the way people can find out more and connect in the show notes. Thank you for coming on the show.
Thank you. Thanks so much for having us.
All right, that's it for today's episode of Token for Your Thoughts. If you enjoyed this conversation, be sure to follow the podcast and stay tuned for more interviews with people shaping crypto and Web3. We'll see you on the next episode.